and welcome to everyone who is just joining our live stream discussion this morning. While we wait for those numbers to climb, which are climbing quickly, I'll briefly introduce myself. My name is Alex Patterson. I am the Executive Director of Canada 2020. And welcome to the first live stream discussion of the Recovery Project. Today, we're talking about the big picture for Canada, and we're going to be going for about 45 minutes. Before I hand things off to Heather Schofield, our moderator for today, I just wanted to send a few words welcome, talk a bit about the project, talk a bit about today's discussion, and then just end off with a few reminders for today. So first things first, I will use this as an opportunity to reinforce some of the public health guidelines. Wherever you are watching this, I hope that you're staying home, staying safe, practicing physical distancing. I hope that you're following the expert guidance of our public health officials, that you're staying up to date with official information and stopping the spread of misinformation. If it's in your capacity to do so, find a safe way to support local businesses and charities, and support frontline workers. We are going to be talking a lot about recovery today, but I'm conscious that the actions that we take now has an impact on that recovery. So if you do know a frontline worker in your life, send them a message of support. So the Recovery Project, I'll talk a little bit about that. So the Recovery Project was newly launched as a partnership between Canada 2020, our organization, Global Progress, which is a network of think tanks and research institutes and organizations around the world, and IFSD, who is the Institute of Fiscal Studies and Democracy. It's based at the University of Ottawa. It is headed up by Kevin Page, one of our panelists today. And it's an effort that is meant to grow. It's meant to be a coalition. And the purpose of the Recovery Project is to build an international coalition of organizations like ours who can start the conversation about post-pandemic economic recovery, even if that recovery feels a long way off. If you joined us through social media or another hub, our main online hub will be www.recoveryproject.org. It will be the central place where we are going to be posting this video and more like it, podcast conversations, some of our original research, some data analysis and visualizations, policy briefings, and when appropriate, we will be doing some in-person events. So we're very excited to launch this. It is designed to be an international effort, but because some of the founding partners are Canadian, we thought it would be appropriate that our first conversation would be based in Canada, and talk a little bit about what recovery could look like here in Canada. So to do that, we have an amazing series of panelists today. Our moderator is Heather Schofield. She's the Ottawa Bureau Chief and economics columnist for the Toronto Star. Next is Tiff Macklin. He is the Dean of the Rotman School of Business and the former Deputy Governor of the Bank of Canada. Next is the Honorable Anne McClellan. She's a senior advisor at Bennett Jones LLP. She's former Deputy Prime Minister and a cabinet minister under a number of portfolios, including justice and health, actually, during the SARS outbreak. And Kevin Page, one of our partners. He's the founding president and CEO of IFSD at the University of Ottawa and former parliamentary budget officer. Good morning to you all. And before I hand things off to you, Heather, just a few reminders to people watching at home. You can submit your questions using the Zoom Q&A function. Our team will be going through and selecting ones that we think we should put to the panelists. We may not get to every question, but you certainly can follow up with us on Twitter at recoveryproj and recovery@canada2020.ca. And I would just encourage everyone to be kind, courteous, respectful of our panelists and their time. And if you love this discussion, if you have to jump out halfway through and you want to watch it afterwards, the full event will be posted online at recoveryproject.org and our various social platforms. So with that, I am going to stop sharing my screen and I am going to hand things over to Heather Schofield. Heather, you are our adept moderator for the day. Take it away.
Okay, good morning, everybody. Thanks for joining us. Alex, I'll just pick up a little bit where you left off, just to acknowledge that there are many, many people caught up in the tragedy of fear and illness and loss of income right now, which is all consuming for those people. It's a privilege at this point, really, to be spared the immediate panic, and probably an opportunity that we should, if we are lucky enough to be able to avoid that tragedy, to spare some thought about the future and how the entire country could come out of this in the best possible way. So, you know, just as we delve into the thick of this virus and how it's affecting us, just, you know, there are some tiny glimmers of hope, I would say, here or there, in some data coming out of some places, but and you know, financial markets have rebounded a little bit, shown some signs of life, and you know, they are always anticipating far in advance of where we are actually today. So perhaps that's something, but I think before we get carried away in that, it's important to acknowledge that this will be a very tough slog, and probably tougher than anything we've come through before. So in terms of setting up our discussion, you know, if we think about how we're handling, if we think hard about what we're doing now, perhaps that could position us better for the future. And I kind of think we're at a point where what we do now really affects, we could go in one direction or another. You know, this could be just destruction, plain and simple, in terms of leaving us with a poor financial situation, a poor economic situation, and income inequalities, and exposed healthcare system, or we could take it in a different direction and learn from some of the weaknesses that are being exposed now, and some of the ingenuity and some of the you know, assertive actions that we see being taken by government, and perhaps take some bold steps. Just a little bit about us in the panel. So as Alex mentioned, I'm the economics columnist and bureau chief at the Toronto Star. I've been covering I've covered quite a few financial crises over time, and kind of in tandem and in parallel to our other panelists here. I've never seen anything like this, as I don't think any of us have. But it's a privilege to be able to talk with people that do have so much hands-on experience dealing with the ups and downs of the past, and I think they bring a broad range of experience that we can draw on. So I think you know, we have four broad themes that we'll kind of get into here and mix it up with your questions. But I'd like to just start off with a question for Anne McClellan about the present situation, and what does it tell us about the weaknesses in our system, you know, our healthcare system and our social system more generally. What weaknesses have been exposed now that could be addressed as we move more broadly towards recovery?
Thanks very much, Heather, and good morning, everyone. Just before I maybe say something specific about weaknesses, or perhaps I might prefer to describe them as challenges, this won't be good news to people, but we need to start thinking about the future, as Heather says, because the next global public health crisis, it's not a question of if, it's only a question of when. And I think our planners, whether they're in the healthcare system or whether they're in the economy and civil society more broadly, need to take on that reality. So we do need to learn from the situation in which we find ourselves, just as we learned from SARS, just as we learned from H1N1. And also, to your point, Heather, we need to understand that this is an unusual circumstance, in that the WHO has only declared a handful of global pandemics. The last one was H1N1, obviously in 2009, but SARS was not declared a global pandemic because it was a number of reasons, one of which was actually very geographically constrained. Unfortunately, Canada was one of the handful of countries that actually had a significant number of cases, but it was not declared a global pandemic. So all our policymakers are actually working in this situation where this is a global situation where there's not going to be a country in the world, I am sure, that is not touched by what we are dealing here with COVID-19. And that has so many implications for our healthcare system and obviously also our economy. A couple of weaknesses, I think, in our system, but in other systems. Public health is the poor cousin of most countries' public or healthcare systems. And we knew this going into SARS, we certainly knew it coming out. And it's going to be really important to do, again, lessons learned in terms of recovery of our healthcare system and taking on board and internalizing in everything we do the importance of public health care and putting the resources, human and financial, into that system so that we can function together. We are a federation, and that has strengths and weaknesses, as we discovered with SARS. But we are what we are, and therefore the resources need to be put in to ensure that we have the integrated systems across the country producing the data in a timely fashion and being able to analyze it and then share it on a national basis and with the rest of the world. And I think we do need to seriously, coming out of this global pandemic, spend more time thinking about what we need that to look like. The other thing I'll say quickly is around procurement. We are butting up against a major challenge in relation to procurement. Again, we knew that from SARS. And yes, the government of Canada has stockpiles, but Patty Hydew, the Minister of Health, very honest, said that in fact those stockpiles are not going to meet the need. She now describes it as the Wild West of procurement. We didn't have that with SARS. We didn't have that with H1N1. In fact, where countries were cooperating, where in fact procurement of needed supplies actually wasn't the number one concern. So we, coming out of this, I think, have to look at how we are more in charge of our own destiny, Heather. And we see this happening with the industrial complex, Canadian industry here, as the government has asked Canadian companies to step up. I don't think going forward we can count on the rest of the world stepping up and being available for whatever reason to meet our procurement needs. And right now, the government of Canada and provincial governments, but especially the federal government, focused on where do we get the things we need to sustain our healthcare system and protect our first responders, especially our frontline healthcare responders. And I think that speaks to a change, and I don't know exactly what that will look like, but in terms of how government ensures that we at home have the industrial innovation and manufacturing capacity to make sure that we're not dependent upon even our friends, because right now we have a problem with the US apparently. And I'll just conclude by saying we in global health crises before have always been able to look to the United States of America for leadership through the CDC, which is the world's best public health organization, best financed, best researchers, largest number of researchers, and best stockpiles of equipment, and so on. And right now, we are running up against a situation that probably no one in this country had expected. And we can talk more about that and the role of the United States in global leadership. But those are just some of my macro preliminary thoughts.
So just to pick up on a couple of those themes, so if we're having all these procurement problems, does that, and this actually goes to one of the questions that we just got from the audience. Does this, I'll throw this question to Tiff Macklem. Does this look like, if we're running into all these procurement problems now, and the United States is no longer backing us up on the healthcare and public health front, does this spill over into a broader protectionism and into a world where it's every country for itself, and this globalization that I would argue has brought us prosperity over the last couple of decades turns into something else?
Heather, there are clearly some real dangers that's going to happen. There has been a shocking lack of international coordination in the response to this crisis, as Anne has just highlighted. And certainly you do worry going forward that it could sort of feed a look after yourself mentality. But I hope that one of the lessons we learned from this is that we are all in this together. This is engulfing the whole world. And we cannot solve it one country at a time. And when you look at most of our big global problems, whether it's a pandemic or climate change, they don't respect international borders. And so I do hope that coming out of this, it actually strengthens and reinforces the need for a multilateral approach. I do agree that historically, U.S. has been kind of the glue and the leader that has kept this thing together. And having the U.S. step up is going to be an important part of that. Canada has a lot to offer, but we cannot do it alone.
So, Kevin, in terms of that not being able to go it alone, the World Health Organization has been, I guess, somewhat central to how the world has been dealing with this. And like, where do you see international organizations and Canada's role in terms of leadership in those organizations going forward? Is that something that we could do on the health front and on the economic front?
Yeah, so I think like coming out of a different crisis, the financial crisis in 2008, we saw an effort that was both domestic and international. Like definitely countries looking at doing their own stress testing, central banks looking at the roles that they play and the kind of support that they can offer, but also like the international community coming together, people like TIF working on financial stability boards. So we saw, I think after that crisis, a capacity for the world to come together. And I think as well, like with this very different health crisis, this was not man-made. This is more of a natural disaster that I'm hoping as well that we could have, the country coming together. So yes, the World Health Organization in Canada playing a key role in that sort of development.
So in terms of, and maybe I can turn to Tiff here to start this discussion a little bit. What action do you think, if we are to position ourselves more strongly, more centrally in this what will inevitably be a bit of a fractured world going forward, are there specific actions that you think need to be taken right now, and where would the government and business alike are we? What's your advice on how we could come out of this in a very good way?
Well, let me start by focusing very near term, Heather. The first response is the social response, and that is all our responsibility. We have to social distance. We have to stay at home, and we as a country, we need to ramp up testing rapidly. We're not going to be able to recover until we can push back this virus. As you look forward, I would highlight three key things to positioning ourselves for recovery, and the first is delivering the emergency relief that the government has announced quickly. As Kevin said, this is not a typical business cycle. This is a natural disaster, and it's moving at natural disaster speed. It's not moving at business cycle speed, and you can't restrict activity in large parts of the economy and stimulate it at the same time. You have to focus on emergency relief. And I would actually give the government high marks for its really sweeping emergency relief effort. But the key thing right now is actually execution and delivery. This is a Herculean task. I mean, the public service needs to rapidly scale up existing programs and stand up whole new ones. We're lucky we have a very good public service, but this is an enormous challenge. I would also emphasize the private sector has a really important role to play, particularly the financial sector. They need to be working with their customers. They need to be working with the government on how to deliver credit quickly. And the objective of all these things has to be to build a bridge to help individuals and businesses get to the other side of this so that we can then recover. The second thing I would stress is we need to start thinking about how we're going to get back to work now, and we need to be planning for that. You know, the health experts tell us it takes about 6 to 8 weeks to flatten the curve with social distancing, stay at home, testing. So we're probably about 2 weeks into that. So, you know, hopefully 4 or 5 weeks from now, we flatten the curve and governments start to lift some of the restrictions. What's going to be really, what we know from other countries, though, is that it's not just going to be a jump back to normal. We're going to have to be cautious. There's probably going to be some re-emerging pockets. Restrictions may come back on. They may be local. They may be more broad scale. But how we plan to get back to work is going to be really important for our ability to ramp back up production without respreading the virus. So I would really highlight the need to reestablish confidence that we can go back to work, we can shop, we can go to school. You know, every company should be thinking about what's the back to work plan. How are they going to get back workers to get back to work safely? How are they going to serve their customers safely? How are they going to deal about disruptions in their supply chain? How are they going to respond to changes in consumer demand? And then from the government side, there's an urgent need. We're really going to need to ramp up testing. We're going to have widely available, fairly rapid testing if we want to be able to get back to work safely. Drive-through testing in South Korea has been very successful, for example. We're going to need things like you know, better social tracking. We're going to need things like telemedicine, and governments and businesses are going to have to be very nimble. And then the last thing I would say in terms of the recovery is, you know, most of the emergency relief measures last about 4 months. So in 4 months, those are going to start rolling off if they don't get extended. And at that point, we're going to probably need to replace them with some more traditional stimulus. So we do need to be thinking now about what does that stimulus look like. And when you get to stimulus, you want to think about the things with the biggest fiscal multiplier. And on top of that list would be infrastructure. And clearly the government is thinking about this. On Friday, they appointed my new colleague at the University of Toronto, Michael Sabia, to be the new chair of the Canadian Infrastructure Bank. So they're clearly starting to think about this. You know, how do we use that infrastructure to build the economy of the future? Are there some big nation building projects? Do we want to accelerate the pivot to low carbon growth? Do we want broadband, 5G for the whole country? You got to believe, coming back to where Anne said, there's going to be some big investments in public health. So those would be 3 things I think about.
Okay, thank you. I'll just jump into a couple of questions from the audience here. Are there economic models or previous examples that we can look to in order to understand how the economy is likely to unfold? Our questioner asked about 9/11, getting airlines back to capacity, what kind of economic relief programs worked and didn't work, and if there are, I guess, anything that we could turn to from back then that would be useful right now. Feel free to jump in, any of you. Maybe Kevin, do you want to go?
Sure. So, this probably, for the most part, understanding this shock goes beyond, the typical kind of models people use at finance departments or central banks. This is every bit as, I would say, as complicated as the 2008 financial crisis. This has, it's a medical shock, as Anne talked about. It's an economic shock. It's also, I think, deals with, with confidence and uncertainty in a very significant way. I think people that look at this probably see it in different phases. Starting, like in this particular case, it started with the China shock, which disrupted supply chains very early on. Then, second stage, we had a number of industries that were disrupted, international travel, transportation. Now, I think many of us, right now, we're in probably this most acute kind of phase where we're in that steep part of that epi curve, the infection curve, and things are being shut down. The containment measures are very strong. But then it's like Tiff alluded to, now, we start to think about what does recovery look like, the fourth stage. So again, these stages are overlapping and they play out in a very global world. So I think, and we're still, a year, maybe, potentially longer away from a vaccine. So we know we're going to be living to some degree with this for a period of time. Perhaps, the economic effects are going to go on. So yeah, I think in terms of the modeling, I think most people think that we're looking at something quite historic in terms of decline in output because of containment in the second quarter. Once you get beyond that, again, how fast can we, start lifting some of these containment measures? Can we do that in an internationally coordinated way? I think, Anne would probably have ideas as to how we can kind of work to do that, across countries. But again, I think that's a global component. But yeah, it could take us, many quarters, years to kind of even get back to the level of output where we were, in the first quarter of this year. So again, this is a significant journey, but for the most part, outside the bounds of models.
So just to pick up on that, Anne McClellan, do you see an international effort there? Like, is it even possible? We're all at different stages of the pandemic, and I think there's quite a few differences among countries about how what kind of social programs and financial supports have been used to tide people through. Is it possible to work together and take it, as Kevin referred, to actually have some kind of global stimulus that would work and to amplify all of those things?
Well, you would like to think so. And I think this goes to maybe some of the things Tiff alluded to earlier. I mean, we've built a global system, and obviously we have different agencies and organizations that have been premised upon a very high degree of multilateralism. It's not perfect, and there might always be a rogue here or there, but you're not used to the United States of America potentially being the rogue. And the United States of America, whether it was the Marshall Plan after the Second World War, whether it was dealing with SARS in a much more limited capacity, they were the global leader. And I wouldn't say they took charge, but they actually, I think, did. And everybody, I think, participated in the ways that they could, but with the United States as a practical leader and in some cases a moral leader. I'm not sure that we can count on that, but yeah, I think that if we're going to get out of this global pandemic, and the word global is really important here, we are going to have to count on our multilateral organizations, and in the health space, the WHO among others. But I guess what I would say is that I am hopeful but skeptical at the same time, in that there seems to be so much self-interest I don't know, somehow things aren't calibrated the way they used to be. And in part, that's because of the role the US is or isn't playing in key areas. And I think it's going to take some time for us all to figure out, whether it's in the health space particularly, or in terms of the broader economy and civil society, whether it is possible to come together and decide what is needed to move the world forward.
So just there are a couple of questions from the audience that are kind of relevant to that. In the meantime, as we're dealing with this unpredictable U.S. powerhouse south of the border there, does it make sense for us to dramatically increase the national stockpile of everything we need, healthcare, material, food? How do we react to that? How should we, as a country, of course, we always want to think about the multinational aspect of it and hope that we can work together. But if there's that reality south of the border, what's the immediate action on that front? Do you want to take that, Anne McClellan?
Oh, well, I do believe in terms of stockpiling, you need to work at two levels, I think, in our country. The national level, where the government of Canada, I think, will be looking going forward to what is likely to be needed, and bring the full financial resources and information resources of the Government of Canada to determine what are reasonable stockpiles in relation to key things. For example, test kits or PPE we've hearing a lot about. But keep in mind the provinces and are the closest, they run the healthcare system, they are closest to the people in those systems. And therefore, in this country, you actually do need, I think, one, a high level of integration and cooperation, but the provinces stockpiling based on their needs, province by province, but the federal government providing an umbrella, if you like, safety net in terms of key aspects of procurement. And then on top of that, I think we just have to think about producing a lot more of these key supplies here at home so that we're not dependent upon China or the United States, because we see supply chains being disrupted for different reasons, mind you, but you see those supply chains being disrupted. And I just think this is a big wake-up call for a lot of people in the world, because things that we thought we could depend on seem not to perhaps be there. And therefore, it is going to speak to the fact that the two key levels of government in a public health crisis are actually going to have to work very closely together and keep their eye on what is needed. You cannot buy 50 million masks and then let them expire. Right? That's just not smart public health planning. Or if they do expire because they're not needed, then you have to replace them and you have to be backfilling. And that speaks to the attention that we all need to put to our public health care system.
Thanks. I just want to switch gears a little bit and combine. We've got a lot of questions, and so I'm going to combine a few and direct this at Tiff Macklem because it's the world that you're working in at the Rotman School. Is there a way? Is this an opportunity, I guess, for we hear so much about our Canada's artificial intelligence capacity and about the digital economy, and here we are with there's huge press for more data, and there's a lot of healthcare data coming out into the public sphere. There could be more, I'll say, but anyway, there's a lot coming out. Is this an opportunity for us to combine our artificial intelligence expertise, take all that data, and really push forward here and turn it into something that could be productive on a competitiveness scale, but also very much on a healthcare scale?
It certainly is. When you think about what artificial intelligence does, it's basically a prediction machine. And it's dramatically dropped the cost of prediction and has allowed us to process massive amounts of data. And there are so many applications of health that are related to prediction. I mean, we're in the middle of a pandemic. This is all about. I mean, all we're looking is curves, prediction curves. But when you, even individually, when you go to the doctor tries to predict what's wrong with you. And Canada actually, because thanks to the work of Anne and others, we have a pretty strong public health care system. And in provinces, we have a single payer model. So the provinces have massive amounts of health data. This is, and the other great thing about Canada is that we're such a diverse society. We can, when we use the data, it has all different people from all different ethnic backgrounds. So the testing is quite representative globally. So there is a real opportunity going forward for Canada to get this data more organized, to figure out privacy constrictions, to anonymize it, and to allow our AI researchers to really accelerate medical research using this data.
So thanks for that. Do we have the data? Do we need more public data? Is that what we need to make this happen? Or can the companies move fast enough to actually be solution finders right here and now when we need them so badly?
Right. So I'm glad you brought that up. So there are some very immediate needs. Some of these are just, physical needs: personal protection equipment, ventilators, proper disinfectants, sanitizers, and we've got to deploy our manufacturing capacity in this country. Universities need to use their labs. It's got to be an all hands on deck to get these critical supplies that we need in our healthcare system immediately. We're also going to need, getting to where I was before, getting back to work in a way that minimizes the probability of respreading the virus. We're going to need personal protective equipment to do that. We're going to need effective disinfectants. We're going to need things like telemedicine if we want to be able to treat people quickly. We're going to need rapid testing. Those are the immediate priorities. I know at places like Vector Institute, they are currently working on all sorts of AI applications to try to help in these things. And then the other piece of it, though, is that we then need to rapidly deploy these things and scale them. And actually at Rotman, we're launching an initiative today through the Creative Destruction Lab to run a special summer program to help scale some of these new AI inventions to try to very immediately help out with the immediate crisis. Then, after we get through this immediate crisis, there's going to have to be a lot of reflection. You've got to believe that we're going to need to invest heavily in the resilience of our public health system.
There are a lot of questions here also about income support and well, I'm going to address this question to Kevin. There are, a lot of reference, we hear a lot of chatter these days about a guaranteed basic income, but I wonder, is that what, clearly the federal and provincial governments are all being creative and aggressive with their social supports and their income supports. Is the basic income just kind of how do you see that? Is that actually a practical outcome and something that we should hope for out of all of this, or is this just perhaps a way for people to say, okay, we see the government actually really supporting people who are in need right now, and this is like, let's take something more general from that and let's keep going with it. Where do you stand on that?
Well, I think the the kind of supports programs that the government's provided, built on top of what some people would call these automatic stabilizers like employment insurance, they're being tested right now. So their ability to provide funds to people quickly is going to be under the microscope. And as Tiff said, this is going to be a Herculean effort on behalf of the public service, key departments, Canada Revenue Agency, Service Canada, to make sure that that money is flowing, and then some of the, the government departments, business development banks, EDC, to make sure that liquidity, those loans are being provided. But I think absolutely coming out of it, people are going to ask themselves, are these existing programs, are they enough? Do they provide us our ability to get cash to people that, that actually fall through the cracks? And I think the government needed to work really quickly, to find out who are those part-timers and those self-employed people that don't get access to some of what, these current income support programs. So I would not be surprised at the end of this, Heather, that we find ourselves looking, piloting more and more, universal basic income programs in certain sectors of the economy, and, working with it to see if we can get it to work. So could it be part of the future? I would say yes.
So just to follow up on that, Anne McClellan, we've seen economic projections, for whatever they're worth, that Alberta will take it is already taking it on the chin in a big way, obviously, but that if it stands to fare the worst out of all the provinces in this. So how should governments thread the needle on that in terms of income supports specifically for sectors that have been dealt a double, triple blow? I'm talking about energy here, while also dealing with the longer term goals of emissions reduction and so forth. I mean, how do we make that? It's a huge question, I realize, and something that goes to the source of things that we've been dealing with in Canada for a very long time. But is there, I guess, you know, if you were to have your druthers there and design the solution for the future, what would it look like right now?
Oh, well, first of all, you have your general programs, right? The national programs that obviously help workers. Let's focus on the oil and gas sector, as everybody does when they talk about Alberta for obvious reasons. You have general programs of general application that are going to assist unemployed workers. And gosh knows we had a lot of them before the Saudis and the Russians decided to fight about the price of oil and overproduce even more, and before COVID-19. So yeah, we have general programs that will help. But I think in terms of a specific sector-based initiative, especially for the oil industry, and certainly it's my understanding that those discussions are going on between the provincial government here in Alberta and the federal government, I think you do have to think about what you want that industry to look like in the future. And I think virtually everybody now in government and in the industry itself realizes that it can't look the way it did 20 years ago. That in fact, this industry has to, and it actually had begun the transition to the carbon constrained world. And individual companies were making investments in clean technology and geothermal and a wide range of technological applications, some driven by AI, Tiff, in terms of transforming the industry. But they were at the beginning of that transition. And of course, then they got body blows, which I've already mentioned, that have made it now it's survival. Now in the oil industry, it's liquidity, right? And which company should survive, which shouldn't, a whole, as you've said, a whole host of questions there. But I think now is the opportunity for the leaders in the sector themselves with the two levels of government to say, what do we want this to look like on the other side? And that had already begun because of the carbon constrained world in which we were beginning to live. But I think that this current situation may accelerate that. And certainly I think the government of Canada would be looking to see that the support it provides not only sustains the best players in the sector coming out of this, but also is helping those players get a much better sense of what this industry will look like 40 years from now.
So I'm actually just going to jump in here quickly. I'm conscious that we're coming up to 10:15, which was when we were slated to end this webinar. There are so many amazing questions that I honestly think that if we were to answer them all, and we should honestly try to do that, we'd be here for another 2-3 hours. So I'm going to ask, just by a nod of heads, if our collective panelists can extend this by just 5 minutes. We'll go to 10:20, and we'll try to either answer as many questions as we can or get in some big thoughts as we wrap up here. Heather, over to you.
Sure. So just to pick up on, I mean, I guess Anne McClellan left us with a fairly, if we could say it's hard to say optimistic in this.
No, I'm not sure I was being particularly optimistic, but maybe realistic, maybe.
But I guess in terms of finding a way to make the most out of this situation, is there something, let's just take it a little bit broader. If we can take this question to Tiff, is there something similarly productive that we could do along the lines of skills training and preparing the workforce of the future? I mean, we've talked so much about, in the months before this crisis, we talked so much about the future of work, and now we're not ready and we have to get ready, and so on and on and on. Can we do this at the same time? Can we actually use this as an opportunity to redesign with all these people, off work? Is there an opportunity there?
Well, it's hard to add too much to Anne's answer. I thought she covered it extremely well. This is an emergency. The price of Western Canada Select, which is the price that a lot of Canadian producers, it's, last week it was $4. You could buy a latte or you could buy a whole barrel of oil. This week it's doubled to $8. Basically, the refinery, if landlocked oil is basically worthless. The refineries are shut. They're not taking it. It's worthless. Clearly these prices aren't sustainable. But you have to believe, I think the most likely scenario is we're going to see much weaker oil prices for, a couple of years. We've seen a collapse of demand. The economy is going to restart. We are going to need it, but there's been a huge buildup of inventories. I do think we need to learn from this. As Anne said, we all know that, 30 years from now, this industry needs to look a lot different than it is today. What we're seeing is, 30 years of adjustment happening in 30 days. And this is forcing a very brutal adjustment. And we need to really help this sector. And as Anne said, there is a rescue package coming. It's going to be important to do this intelligently, to think about how do we both rescue it and have a more orderly transition, but make sure we have a transition. And that's partly that's about workers, but it's also about technology. And we need a plan that brings those two elements together.
Okay, thanks. I think last question for Kevin. So, back in the olden days before we had this crisis, Kevin, you were raising some serious questions about the level of debt and fiscal capacity. And here we are clearly with a national consensus that, whatever it takes, right? Let's do as much as possible on the fiscal front and through, the Bank of Canada's balance sheet. And, this is it's beyond anybody's wildest imaginations. Can we afford all of this plus a stimulus package along the lines of what Anne McClellan and Tiff Macklin have been talking about, that will position us better? Can we afford to do all of these things at once?
Well, I think the short answer would be yes. I think the federal government is in a good, is in a good fiscal shape. It's fiscally sustainable. So I think people are talking about deficits going from something like 1% of GDP to potentially as high as 8 to 10 percentage points of GDP. I actually was at Department of Finance through the 80s, and we actually had deficits in the 5% range quite often, and we even hit 8%. So this is not really unprecedented. I think, again, the feds need to step up. I would say there are provinces in this country that we're going to need to kind of support as well in different ways. Like Anne talked about Alberta. I think we've heard from premiers in Manitoba and Newfoundland. They're going to have some serious difficulty, meeting basic needs. So I think, again, Tiff talked about a need for infrastructure programs and talked about the need to kind of look at, disease prevention and control. You raised the issue of income support, skills and training programs. I think looking at some of our fiscal stabilization programs and the kind of adjustment packages we're going to need for provinces is going to be, we need to do that as well as we kind of work our way through the summer and into the fall.
Okay, thanks. Alex, do you want to pick it up?
I do. Okay, so thank you for extending by 5 minutes, everyone. Thank you for joining us, everyone who joined the stream. I was watching our numbers. We actually held our audience throughout the entire duration of this chat. In terms of questions, Kevin, you'll be happy. I have a series of entire research projects based on some of the questions that we've been sent here by our attendees, and I suspect actually that you will be seeing the Recovery Project curate some more live stream discussions based on some of these questions in the future. I would encourage everyone to, if you're not on the Recovery Project's mailing list, please get on our mailing list, because we are going to be doing a lot more of this kind of activity. I will just simply end by saying thank you to our viewers, and also thank you to our panelists, Kevin and Heather here in the Ottawa area, Tiff in Toronto and Anne in Edmonton. Thank you so much for joining us and sharing your insights with us, and watch this space. We'll be doing a lot more of it soon.
Thanks.
Great to see you all. Bye.
Bye, everyone.
Bye.